All right, welcome back to the Safety Burst Conference hosted by Beyond Clean and sponsored by Sertol International. I am very excited to introduce you to the next speaker, Bob Mars, the man, the myth, the legend. He's the VP of Organizational Development for Beyond Clean, the VP of Clinical Consulting for Beyond Clean. Bob has a passion for excellence in sterile processing and believes that certification through education provides the foundation needed for superior patient care. Bob is all over the place, traveling around helping frontline technicians, department leaders, really fine-tune their processes and troubleshoot issues in the department. He's passionate, and I know that he's going to be passionate about this topic as well. In this presentation, he will discuss the importance of monitoring low-temperature sterilants and explore the chemicals used in sterile processing. We'll discover OSHA regulations and concerns with these chemicals that impact our industry. So without further ado, Bob, welcome. Happy Saturday to you. I would like to turn it over to you.
Thank you very much, Lindsay. I'm super excited to be here with everybody today. I was kind of joking with everyone and telling them this morning that I'm just as nervous as a long-tailed cat in a room full of rocking chairs. I don't know why, but I'm super excited to be here with you. And I, too, want to welcome you to this presentation titled High Times, the Importance of Chemical Monitoring in SPD. And I think it's a really good and a real timely topic because we don't spend a whole lot of time talking about it. It seems like in our sterile processing departments, we're focused on IUSS or staffing, or are we going to get new equipment, or are we going to get anything? We seem to never get anything. So I'm really enjoyed it. We're going to talk about this topic today, and I hope you hear one or two or three things that you've never heard before. So we will jump right into it, and I'm just going to move some stuff around on my screen so I can see a little bit. But first, I want to thank ChemDAC, who has sponsored this presentation. It's really, really cool and very nice that they have chosen to sponsor this, and it's right up their alley because when it comes to chemicals and monitoring them in your departments, nobody can beat what they're doing. So I'd like to send a personal thank you and shout out to ChemDAC for sponsoring this session. So let's talk about our objectives today. When we think about monitoring these chemicals, we're going to discuss the importance of monitoring them in sterile processing. And really, there's a lot that goes into that. We're going to explain the impact that proper monitoring has on SPD, the department, but also the personnel in the department. We're going to describe chemicals that are used in sterile processing and that are impacted by OSHA, or the Organization for Safety and Health Administration, and their standards on sterilants, HLDs, and cleaning agents. So we'll talk quite a bit about that and talk about OSHA's role in this topic. And then finally, we'll discuss training that should be related to chemical monitoring. So before I get started, I wanted to ask everybody a poll question. And that poll question is, does your department monitor all areas where chemicals are stored and are used? And I'll give you just a couple of minutes here to check on that. But it's really important to understand whether or not your current hospital department is, in fact, monitoring the areas where you have chemicals, where they're stored, or where they're being used. So I'm really looking forward to hearing your answers on this one. Okay, so I just flipped over, and it's really interesting. It's coming back at 53.6% are saying, yes, we are in fact monitoring, and 46.4% are not monitoring in their departments. And this is really a telling I'll call it a mini survey, because we know, and we're going to find out through the rest of this presentation, just how important this monitoring is in your department. It is vitally important to the safety of your department, to the health and safety of your staff. And as we go through the presentation, we're going to talk more and more about that, why it is so very important to make sure that we are, in fact, monitoring. So why monitor? Well, it's because OSHA, the Occupational Health and Safety Administration, says we have to. They want us to think about things like PEL and TWA and AL and STEL. So we'll expound on those a little bit, but it's really important to note when you're thinking about this that ETO has been regulated for a very long time, really since 1984. And they set a PEL, a personal exposure limit, of 1 part per million, and an AL, or an action level, of 0.5 parts per million. And both the AL and the PEL are expressed in an 8-hour TWA, or time-weighted average. So they want to know how many parts per million that you are being exposed to of these chemicals in an 8-hour period. And then OSHA went on later to amend this to say, okay, not only do we want to see and ensure that you're not being exposed to 1 part per million over 8 hours, we're going to amend this rule and add a claim that says we're adding a 5 part per million STEL, meaning a short-term excursion limit. So they brought this into play primarily in the day when some of y'all that maybe are my age or a little bit younger might remember when we had an ETO sterilizer and we had an ETO abater that were separate units. So at the end of the sterilization cycle, we had to remove that big cart loaded with process devices in an ethylene oxide cycle. We would pull it out and then place it into the aerator. And they put this in place because they realized that well, really the rule, and they wanted us to pull these loads and to never push, but you had to push to get it into the load. And when you pushed, there was potential that you were going to be breathing in this harmful chemical. So they brought on the short-term excursion limit to make sure that we're being safe. And they did that again, back in the day, where we had personal monitoring or measuring badges that would tell how much ethylene oxide we were exposed to. It reminds me of my days of scrubbing in the operating room when I would clip on my X-ray badge, because I did a lot of orthopedics and I was exposed to a lot of X-rays. So they wanted to measure that and keep us safe, and it's really important that they do that. So just wanted to give you a little backstory on this and kind of explain some of these. I have a ton of these little, I'll call them letter puzzles, as we go throughout the presentation today. There's so many letters, and we want to make sure that y'all totally understand what we're talking about. So just some backstory on ethylene oxide, and we'll talk about it a little bit more later in the presentation. So in 1970, the Occupational Safety and Health Act was signed. And one thing that they quickly understood about this is that it was under-resourced, and they did not do surprise inspections in healthcare facilities. So it was kind of an odd situation where they're saying we have these dangerous chemicals in facilities, but we're really not going to check on you to make sure. We're going to leave that up to the hospital to ensure that you are, in fact, protecting your employees and doing what you're supposed to do. So they created NIOSH, which is the National Institute for Occupational Safety and Health. And then the OSH performed research on all of these chemicals to make sure that, again, that facilities were monitoring them correctly. So it's important to note that they never come into your facility voluntarily. They only come into your facility when they're asked to come in. But as a caveat, they have joined with the Joint Commission to partner and talk about safety and chemical safety in the workplace. So really, really important to know and understand that. So as they work together, they're developing and enforcing these OSH standards. Following the leader. So employees are required to follow many standards in the hospital, and we know that. But here are some that are applicable to sterile processing. Both employees and employers must be familiar with them, and these standards are intended to work together, again, to keep you safe. So we've got the Emergency Action and Fire Prevention Standard, 29 CFR 1910.38 and 39. We have the Communication Hazard Standard, again, 29 CFR 1910.1200. We all are very familiar because of decontamination about the bloodborne pathogen standard that's described in detail in the AAMI document. It's, again, 29 CFR 1910.1030. And then two that are really important specifically to this presentation are air contaminant standards, 1910.1000, and then the ethylene oxide standard that we talked about, 1910.1047. So where does H2O2 fall into this? Where's the hydrogen peroxide standard? And we'll talk more about that again as we go through this presentation. So when you think about a hazardous communications standard, your CFR 29 or 29 CFR.1910.1200, all hazardous chemicals in your workplace should be classified and the risks fully communicated with the workers. So 1910.1200, the purpose of this section is to ensure that the hazards of all chemicals which are produced and imported are classified, and that the information concerning all the classified hazards are transmitted to employers and employees. So that's section 1. In section 2, they go on to say that this section applies to any employee who may be exposed under normal use conditions. So they're wanting to make sure that throughout the course of the day, if you're using the chemical and there's a potential that you could be exposed, they want to make sure that you understand the hazards that are related to that. So this standard was put into place, again, to keep us safe. So really, really important to think about that as you're going through your day. And particularly, if you're leading a sterile processing department, it brings to light the importance of how well we understand these chemicals, how they're used, why they're used. And again, we're going to talk about that a lot more as we get further along. But in section 2, they want to make sure that we are protected no matter what, and that this standard applies to any workplace where chemicals are used, and the employers are, again, employers are expected to assess the risks related with these chemicals and then pass those associated potential risks onto the department or the facility that may be using these varied products throughout the day. So again, really, really important as we go through this presentation. So when you think about sterile processing hazards, I think we can safely say that everything in our department is hazardous. And if you've worked in sterile processing for any time, I think you know what I mean. Anybody that I know that's been in sterile processing for any time it has shown the signs of working in sterile processing, whether it may be a burn somewhere on your body. I'm pretty positive that most of y'all can relate to me. I'd like to ask the question, how many of y'all have actually torn the skin off your finger when you're tearing the tape off the dispenser, whether it be your Sterad tape or your steam tape or your ethylene oxide tape? I can't tell you how many times I've been in a hurry and I rake that thing and I'm like, oh, I got my knuckles. This drives me crazy. So we all are showing the battle scars from days that we've spent in sterile processing, and everything is dangerous. We're working with all of these chemicals in decontamination in our manual operating sink where we're manually cleaning the instruments. We have chemicals in our ultrasonic. We have chemicals in our washer disinfectors. We get over to the clean side. We have different chemicals and different sterilization modalities that we're working with every day, whether it's H2O2, hydrogen peroxide, ozone, ethylene oxide. All of these chemistries are dangerous and harmful to us. But what about those live spores that we're putting in the loads and that we're putting in the incubators? Stereothermophilus, or Geobacillus stereothermophilus. We're using live spores in the department, for heaven's sakes. So it seems like in every direction or any way that we turn, we're potentially putting ourselves in danger. So it's really, really important, again, that we're monitoring all of this. We understand that disinfectants and detergents are used to remove soil. It's important to understand that the sterilization modalities are designed to destroy life. And anyone that's exposed to them can be harmed. So we've got to be really cautious to look at that. And if we dive a little deeply into it, again, 29 CFR 1910.1200 says hazardous chemicals mean any chemical which is classified as a physical hazard or a health hazard. It could be a simple asphyxiant, a combustible dust, a pyrophoric gas, or a hazard not otherwise classified. Health hazard means that a chemical which is classified as posing one of the following hazardous effects. It could cause acute toxicity, any route of exposure. It can cause skin corrosion or irritation. It can cause serious eye damage, irritation, respiratory or skin sensitization, germ cell mutantology or mutagenicity, meaning it can mutate cells. They're so powerful. So we've got to understand how vitally important it is to understand just how very dangerous these chemicals are. And we've got to understand how and why we've got to use them safely in our department. So let's talk about these chemicals again. So we know that chemicals like sterilants and high-level disinfectants have made the bad boy list, but employees should also be aware of the risks of the lesser-known products that may be used. So we could be talking about peracetic acid, glutaraldehyde, OPA, cleaning agents, enzymes, detergents, bleaches, quats, alcohols. There are so many of them out there. We've just totally got to understand them and understand how they impact us and just how dangerous they can be. So this next chart we're going to show, again, is really important. When you talk about the toxicity standard for low temperature sterilants, it's, again, very, very important to understand the PEL, the permissible exposure limit, the ppm, the parts per million, the TWA that we talked about, that time-weighted average. How much of this can I be exposed to over time? What about the IDLH? Immediately dangerous to life and health. And then again, NIOSH. So all of these are so vitally important. So ethylene oxide has a cancer classification from the EPA, the Environmental Protection Agency. It is a confirmed carcinogen by the IARC. And again, this is a really important company to understand who they are and what they do and what kind of processes they protect us from. But again, the NTP, it's known to be a carcinogen to humans, and we need to be aware of that. But also, hydrogen peroxide, H2O2, has an inhalation of vapors, mists, or aerosols from concentrated solutions of hydrogen peroxide can cause significant morbidity. Did you know that? Did you know these chemicals can cause a significant morbidity? It's really important to understand and to know that type of stuff. So they go on to say, because it is nearly odorless and non-irritating except in very, very high concentrations, persons may not be aware that they're being exposed to it. And this brings up a very scary issue. So if you're using it, how do you know if you've got a leak? How do you know if the PEL or the exposure levels are so high that they potentially could be damaging you? There's no odor threshold. So we've got to be sure that we have a detection of odors that can give us a warning to these hazardous chemicals to ensure that we're tracking them properly, that we're understanding what's going on. And just to take it a little bit farther, again, in 2013, the EPA came out and talked about ozone pollution and how it poses risks of asthma hazard and worsening COPD. And it's likely to cause cardiovascular harm, e.g. heart attacks, strokes, heart disease, congestive heart failure, and it may harm the central nervous system as well. And it may cause reproductive and developmental harm. And so the U.S. Environmental Protection Agency said, listen, we're going to make this known in the ozone and related photochemical oxidants standard of 600-R-10-076F. So really, really important that you kind of dig into these again and learn how these chemicals and how these sterilants can be toxic in your department and can be impacting the health of your employees. So let's have another question here. Does your department currently use ethylene oxide, ETO? I'm looking very forward to hearing this one as well. I do see it in my travels, so I'm anxious to hear your thoughts on it. How many of you actually still have it in your department and are using it every day to sterilize devices? Whoa. Okay, so the poll question, 4.3% of you are saying, yes, we have it, and 95.7% are saying, nope, don't have it in our departments. So this is another really interesting one. So at my previous place of employment, we had ethylene oxide, and one day I received an email from our administrators that we were going to get rid of it. For those of you that don't know, in the Austin, Texas area, they're very environmentally conscious and friendly here. I didn't know that coming to Texas, but they're very, very environmentally friendly. So they sent me this email. So I started going through all of the products that I was sterilizing in my ethylene oxide sterilizer, and I started reading the IFUs, and many of those devices only had ethylene oxide as the sterilization of choice in the IFU. So I sent a list back to my administrators and said, listen, I would like to get rid of this like you or as much as any of you, but who is going to help me explain to Dr. X that he can no longer use product X because I have no way of sterilizing it? And they said, well, we bought you those expensive low temperature sterilization machines that you're currently using with it, so throw them in there. And I said, well, you know, we can't do that. I can't just take a device and throw it into another low temperature modality because I feel like it. And I talked to them a lot about the 510K process and how companies go about validating their product for use in the healthcare market. So ultimately they let us keep it, but what they did let us do, so back then, I had the big giant sterilizer with a big giant aerator next to it. And they let me remove that. I said, what you could do is let me use the newer sterilizer that's safer, that has the sterilization component and the aeration in the same chamber. So my staff don't have to pull something out that's been exposed to ethylene oxide and then potentially be exposed to that it themselves. It will be fully aerated when the cycle is complete. So we moved to that. We purchased 2 of these smaller ethylene oxide sterilizers, and then we were able to continue sterilizing using ethylene oxide. And for those of you that use it, you're probably aware of the abater. So we had an abater too that would take that ethylene oxide gas and convert it to carbon dioxide and water vapor and then kick it out into the atmosphere. So we wanted to make sure that it was being used properly and we were keeping, again, our staff very, very safe. So when we talk about hazardous chemical classifications, any chemical used in concentrations that can exceed OSHA's or the ACGIH, which is the Association for Advancing Occupational and Environmental Health. Work exposure levels should be released. If information is available, they need to release it on something that you all should be very familiar with. It's the SDS, the safety data sheets, and that labels must be provided for those chemicals. So chemical manufacturers have to know that importers are required by law to provide access to these hazard chemicals that they utilize, but they also have to be labeled properly, and they have to classify them using these labels and safety data sheets. So they can't just hand me a bucket of something and say, hey, here, you can use this, but there's no label or there's no instructions from the manufacturer about these chemicals. So again, really, really important that we understand that. So as the manufacturers provide these chemicals to us, it's very important that there's a specific communication plan that goes with them, that is written, that has a location with rules and expected training, and most importantly, it's got to be available. So the plan should be specific for what people should do in case of an emergency. And I love this slide. A goal without a plan is just a wish. So we need to make sure that we're bringing this information to our users or our staff, our employees, and we make sure that they understand it, that they've got a plan in place to understand how important it is and what they should do during an emergency. In addition to that, the hospital should review the potential hazards, and they need to talk about what types of things could go wrong. For example, is there an ethylene oxide leak? If there is, the ethylene oxide alarm will sound. And what happens when it sounds? What do your people do? Do they run around the department with their hands over their heads, screaming, running in circles? No. We should have a designated area that they should go to until they're given the all clear. And this kind of takes me back to my military days when we all had the distinct opportunity to enter, they called it the gas chamber at the time, because they basically put us in a cinder block building and filled the room with tear gas. And we would go in there with our gas masks on, breathing, and then we were asked to remove our gas mask, and then we had to say our name and our rank and our serial or social security number. And so you're already hyperventilating in the mask because you don't know what this stuff's going to do to you. And then as soon as you take it off and you start talking, you inhale it and you start coughing. But as you come out of the chamber, people are running, and they had us flapping our arms. And so we don't want our staff in sterile processing doing that. And you want to talk about gross. It's the first time, I think, in my life that I've ever had something running from my nose, literally, and dripping to the ground in the same strand. It was awful. So we don't want to have our staff running into something like that in our department, right? We want to make sure that they understand completely that if we have an ethylene oxide leak, that they understand the alarm will sound, and they're going to evacuate the department. I, as the leader, am going to let administration know. I'm going to call the fire department. They're going to come in, and they're going to give us the all clear when the gas is cleared out of the department, and it's at a safe level where we can come back to work. So really, really important. And I actually had this scare in my department. And I think the biggest thing for me was that we were already using area monitors. But had I not been using area monitors, myself and my staff could have been walking around that department for days inhaling ethylene oxide, and we would have known nothing about it. But thank goodness we had the alarm, and we found out that the leak was actually between my autoclave and my abater. So this back room was filling up with ethylene oxide gas without our knowing. And then the alarm sounded. My staff knew we had a very specific plan that allowed them to leave the department to a safe place. We contacted the fire department. They came in. After a few hours, they gave us the all clear, and we shut our ethylene oxide sterilizer down, and everybody was safe. But again, I got home that night, and I really started thinking about just how scary it would have been had we not been monitoring these chemicals in our department. So again, really, really, really important that we think about that, and we think about that safety procedure as our staff go forward. So when you think about the chemical inventory or the chemicals used in your department, do you have a chemical inventory list? While the chemical inventory list should be checked at least once a year, it should be continuously updated. Listen to me now. It should be continuously updated as new chemicals are purchased and as empty ones are used up. And employees should have a written list of all chemicals on site. They should be listed by department or facility, and they should be added and deleted again as you use or get rid of or bring new stuff into the building. In these chemicals, according to 1910.1200, it says a list of hazardous chemicals known to be present using a product identifier that is referenced on the appropriate safety data sheet. The list may be compiled for the workplace as a whole or for individual work areas. So again, they want us to make sure that we've got this information, we've got the list updated, and we know exactly where the chemicals are stored, again, what our emergency action plan is going to be if there's a spill or an exposure. So just make sure that if you do not have one, that you have this available to your staff. So what about those labels? What about strange jars that could be laying around of mystery something? I'll tell a couple of stories here. So if you, I'd be interested to know, and I don't have a poll question here, and now that I think about it, I should have. But I don't know how many of you remember potentially a situation that happened at Duke Medical Center a long, long time ago where they had the larger 30-gallon containers of detergents that they were using to feed their washer disinfectors. They had an empty one that they placed in the hallway for the housekeeping staff to pick up and dispose of. But before that happened, there was a person who was in the facility that was working on their elevators, and he needed to drain the hydraulic fluid, and he saw this beautiful big plastic container and thought, hey, that'd be wonderful. So they took that, they drained the hydraulic fluid into the container, they put it back in the hallway. A sterile processing person saw the full container, brought it back into the sterile processing department, and ultimately it got hooked up to the washer disinfector. And unbeknownst to staff for a number of days, they were cleaning their instrumentation with hydraulic fluid as opposed to the proper chemistries that should have been in the washer disinfector. And this really, really, really caused some significant issues. So not only understanding how products are labeled, how and why they're used, we have to understand that we've got to know, again, where they're stored, and we've got to ensure that they're stored properly. And when that product was brought back into the department, somebody should have noticed that this product smelled different and then it looked different than what they used every day. But it didn't happen for a few days, so patients got exposed. And then, of course, in the United States, we're very litigious, so let the litigation begin. So it's really, again, it just goes to tell us the importance of understanding it. And I'll tell you one more really gross story. So a very, very long time ago, I was going to college in a small West Texas town. And for those of you who live in that area, you're going to understand what I'm talking about. But everybody back then put chewing tobacco in their mouth. Some people put the big wads, some people use the dip, and they would spit into a cup or spit into a Coke can or something. So it takes me back to those days. So every Friday night, we would have a big poker party in our dorm room, and friends would come from all over, and we just have these round robin tables playing poker and just having a blast and laughing. And of course, all these country boys were spitting into their pop cans. I'll call it pop because I'm from the Midwest originally. Down here in Texas, they call it Coke, even though it's Sprite or Dr. Pepper or whatever it may be. So at any rate, one individual was spitting into a Pepsi can, and a person who joined at the table was drinking from a Pepsi can. So let your mind wander for a minute, and you will understand that it didn't take long for the gentleman drinking the Pepsi to grab the spit can and take a nice little sip on the spit can. It's just disgusting. So even though that product was labeled, we really didn't have a safety briefing, and we didn't have a chart to say there are hazardous things in this dorm room, so make sure when you pick up your Pepsi that it smells like Pepsi before you take a sip. So, okay, I'm sorry, totally gross story about a product or a hazardous grossness being ingested, but it just goes to show how easily something can happen. So again, it brings to light the importance of how we look at it, how we monitor it, how we take care of it, and we want to make sure again that we're doing it for the safety of our staff. So in 2015, the GHS pictogram came out. And what they wanted to do is the government, they wanted us to use these pictograms to make sure that they are a part of better communication. So I guess going back to my ACU story, so here in West Texas, if the guy that picked up that Coke can had picked it up and there was a pictogram or a picture of a guy spitting into a cup on that Pepsi, he probably would not have taken a drink of it when he did, but it didn't have that pictogram on there. So OSHA brought this hazardous publication out saying that we want to make sure that along with all of these confusing instructions and everything else that's on the label, we want to make sure we have an additional picture or pictogram on there so people can easily identify the danger related to this chemical or to this sterilant. So this was really, really important. So when you think about labeling, this is a big deal. So they want to have you have your product in a specific container. They want to make sure that that they are labeled and the language is very clear to all. So the labeling requirement also applies to any waste chemicals. So the container must be labeled except those that are prepared for immediate use or used by the same person in the same shift. So that's a great idea. But the label language they came out with and said, if you guys remember, I've talked about John Nance in the past, and English is the language that's standard for pilots and aircraft. So when they talk to the control tower, they speak in English. And much like that, these chemical companies are expected to have all of their labels in English. In other languages can be added, but at a minimum, they have to have it in English so everybody understands. They want to understand things like when these products are used, that they have a product identifier, words and pictures and symbols and a combination thereof. So it's very clear and very understandable for our staff to read and to use them appropriately. So when you think about the NFPA diamond, it's talking about reactivity, fire, health, and others. And what they do is they rate these products on a scale from 0 to 4. 0 meaning they will not burn, to 4 meaning that they are very flammable gas or vapor. So these hazardous materials have this HMIS, it's the Hazardous Materials Identification System. So you have the diamond, and you've also got a bar that labels them 1, 2, 3, 4 to tell you how they should be labeled. And this is widely used now throughout the world. So it's very important, again, that you're teaching your staff to understand what the diamond mean and what the pictograms mean and what the bar means as far as the chemicals and how they're used and how dangerous they are. And when we go back to safety data sheets, this is something that we're all aware of because every manufacturer that comes into our facility is providing a safety data sheet. And there's a ton of information in this safety data sheet. They're essentially the same as the old ANSI format chemical suppliers. They have basically a 16-part plan that should be included in every SDS sheet, and that goes from name and identification to hazards to composition to first aid to firefighting, accidental release, handling, storage, exposure, physical and chemical properties, stability, reactivity, toxicity, ecology, disposal, transportation, regulations, and it kind of goes on and on and on. But we want to make sure we've got all of that information. We want to make sure that it is understood that if you're working in a facility and a product comes to you, that manufacturer is required by law to provide you with an SDS sheet. And then you are responsible as an employer to make sure that your staff have these SDS sheets readily available, that they know where they're at, that they understand the chemicals, and where they've come from. So again, it's when they did this and they created this, they have the RGH, that revised global harmonization. They were trying to bring everyone together on the same page to understand exactly what these products were and what they were used for. So we're going to jump into employee training now and talk about that for a few minutes. When we think about employee training, new employees must train or whenever they're assigned to a new task. So you're looking at these chemicals, and you need to look and make sure that new employees are being trained. And if you have older employees and they're in a new task where they're using these chemicals, they're being trained properly to make sure that they know the chemicals that are being used, again, the location of all of the SDS sheets, that you've got a written plan and that you have your chemical inventory list, and they know and they can find where they are and that they are readily available. And this could be something that the surveyors, either DNV or the Joint Commission, could ask your staff, is where is your written plan for your chemical exposure? And where is your inventory list? And where do you keep your SDS sheet? So it's really important, again, that they understand that. So another question, does your department have formal training annually concerning hazardous chemicals and sterilants? Do you have that every year? Do you sit down with your staff? Do you have them pick a chemical and read through the SDS sheet, or be able to explain, hey, I know this glutaraldehyde, and it is this. It can cause this. If it's spilled, I have to clean it up this way. I have to dispose of it this way. Is your facility providing you with this kind of training to ensure that you're staying safe in your department? Again, really cool results. So 33%, 33.3% are saying, yep, we get training. 66.7% of the people listening here today are saying, no, we don't receive training. Guys, let me just speak to the leaders here for a minute. If you are the leader of a sterile processing department, it is your expectation, it is your responsibility to ensure that your staff understand the chemicals that they're using, that they understand what they're used for, that you have a written plan, that you've got the chemical list of products they're using. So when you go back to work on Monday, start working on this and make sure that your staff know that you care about them and that you are keeping them safe. So very important. So what kind of training, when they talk about chemical leaks, should you receive? They want to know, where are chemicals used? They want to know what can go wrong, what can happen if something goes wrong, how do you detect the presence of a leak of a hazardous chemical. And the employee in training, it should include at least methods and observations that may be used to detect the presence or release of a hazardous chemical. And they want your staff to completely understand this. So again, they're going to go back to 29 CFR 1910.1200, and they want them even to be aware of what chemicals can cause physical harm, what can cause health issues, simple asphyxiation, are they combustible, do they have pyrophoric gases again? So, and they've got to know how to take care of these things, how to protect themselves, what PPE to wear, how to clean them up again. So again, really, really important and a lot of very detailed information. So another really good chart here, the symptoms of chemical exposure. Did you know all of this? Did you know that ethylene oxide leads the top and has an X in every box? Did you know that glutaraldehyde is running right behind them very closely? But what about right below that? Did you know hydrogen peroxide causes eye irritation, nose, throat irritation, lung, skin irritation? It's sensitizer to, it can make your allergies worse, your asthma worse. But we also know that it's a mutagen. But even one step farther, it's a known animal carcinogen. So if it's impacting animals, what impact could it have on us as employees? I think that's something that we really should learn and try to figure out. So perception of sterilants and disinfectants. We talk about hydrogen peroxide, ethylene oxide, glutaraldehyde, all of these things. If there is no odor, then how do you know how much gas is present? Even if you can smell it, most people can't quantify by the smell how much of a vapor concentration is present. And oops, I have a cold today or my allergies are acting up. What if my nose is stuffed? I should have asked another question here. How many of us have had our noses calibrated? The answer is none of us, right? So we can't smell something and know whether or not it has exceeded this standard. So again, it brings up the importance of area monitoring. So they want us to train and understand our staff to understand chemical hazards, chemical sterilants, because they are designed to kill all life, even if they're a resistant bacterial spore. Therefore, if it's released, it poses a risk to anyone in the department. So we have to, again, make sure that we're talking about these chemical hazards and passing this information on. We also need to make sure that we're training to prevent exposures. An example of a workspace exposure might be, again, ethylene oxide. When I pull it out of that cart out of the autoclave, there's not too much danger. But then when I push it and it's a non-aerated load, then that non-aerated or ethylene oxide gas is blowing back at me and I'm potentially being contaminated. So we need to make sure, again, that we're training so our staff understand again the importance of keeping ourselves safe in the workplace. We know that we have to have training on personal protective equipment, and I go back to 29 CFR 1910-1200, where we talk about this using personal protective equipment in the decontamination area. but I can't tell you how many times I've seen people enter a room where chemicals are stored with no PPE on to take the chemical back to the department to hook it up to the machine. So we need to make sure that they understand that the wrong gloves or respirator can give you a false sense of security. So understanding the exact PPE that should be used, surgical masks won't protect you from an exposure to a low temperature sterilant or liquid chemical sterilant. PPE must be provided to an employer that is appropriate for the task to protect the employees. And again, some PPEs, such as respirators that require annual fit testing and training, are required to be used in these areas. And do you have them, and do your staff understand that you have them, and have they been trained on how to properly use them? Again, very, 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 very important when we think about the health and welfare and safety of our staff. And let's just go back to a simple statement. At the end of the day, sometimes even the best equipment out there fails. I was driving down the road the other day, and there was a big old Mercedes pulled over on the side of the road, broke down. And we all know that typically Mercedes are equated with quality, but it broke down, and they were sitting on the side of the road. So we need to understand that just like that, many pieces of equipment that we have are gonna fail at some point. So we want to make sure that your staff understand that there are issues. And if your staff have questions on this, they could, for example, go to the MAUDE report through the FDA, the MAUDE report, and go to the database and type in H2O2 sterilizers or ethylene oxide sterilizers or whatever chemical it may be. And these reports will be listed in there of people who have actually went to the FDA and said, hey, we have this issue at our hospital and we want to make sure nobody else has to deal with it. So really, really important that you're looking at that. And again, they want to talk about emergency preparedness. So when things go wrong, these questions need to be answered for employees to protect themselves from potential exposure to hazardous gases and chemicals. What the employees should do if there is a major chemical spill, how they will know if there is a leak from a gas sterilizer. How will others in the department know? What should people do if they're exposed to chemicals? And what are the department policies? So think about that. What they should do, how they will know, how they should deal with it, what they should do in the process of dealing with it, and then finally, what are the departmental policies for dealing with this and again, helping our staff understand that we're here to keep them safe. And as a little caveat, again, kind of a trade secret, a chemical manufacturer does not have to specify data about what is in their chemicals. However, they must provide an SDS and labeling with the hazards to the workers and also the emergency contact number for a nurse or a physician. The compositions or the makeup of that chemistry can be kept secret or an official composition trade secret, but we have to let them know if they're dangerous and what's in them. So again, knowing this is very important in the training of our staff. And when we think about special chemicals, I'll just say a little bit about ETO here again. ETO was used for decades before it was classified as a carcinogen. NIOSH then came out NIOSH has not come out with an update to these exposure limits they set for a very, very long time. So we don't know if it's more dangerous or less dangerous. There's no way to know. Newer low temperature gases and liquid sterilants should be used with an abundance of caution. Most chemicals in the workplace fall under this HAZCOM or hazardous communication standard. A few special chemicals have their own standard, mainly carcinogens. So ethylene oxide, formaldehyde are two examples of that. But it's really important to know that these others do not. So finally, we're not going to talk a ton about ethylene oxide. I just wanted to talk about it to merely show you how it relates to the HAZCOM, hazardous communication, and the OSHA standards. And many requirements and ETO standards are also in the HAZCOM standard. They're gas-specific versions of HAZCOM, where they have signs and labels and respiratory protection and emergencies and training. So we need to understand that we need to have that visible to our staff if we're using this product in our department, so they understand just how dangerous it can be. And again, we've spent a lot of time talking about a lot of dangerous chemicals and sterilants, but at the end of the day, I believe as a leader and a former leader of a department that we have the responsibility to make sure that our staff understand. And this is a ton of information. It can be very, very confusing. So we have got to go above and beyond to ensure that our staff knows that we care about them, that we love with them, and that we want to take care of them when they are in our workplace. That we're going to be the kind of leaders who care more about them as people than we do as SPD workers. That we're going to do everything in our power to protect them, to keep them safe on a daily basis. And we're going to provide them with the training and the tools necessary to keep them safe. And I'll go back again to my ethylene oxide story, that ethylene oxide and H2O2 have the exact same parts per million, and that's 1 part per million time-weighted average over an 8-hour shift that we should be exposed to. So why are we not expected to monitor H2O2? Why? We need to be pushing back to the government and saying, listen, if it has the same parts per million and can hurt me, I want an area monitor in my sterile processing department. So again, I'm talking to the leaders here very quickly. I've gone a little long, but leaders, talk to your administrators and take the information from this presentation to use to fight your battle to get the area monitors that you need in your department to keep your staff safe and to keep yourself safe and to keep your patients safe. We owe it to ourselves, we owe it to our staff, and we absolutely owe it to our patients. I'm going to stop right there and just say a huge thank you for letting me spend this time with you today. Again, I know it was a ton of information, and I talked fast, and I just pray and I hope that you learned something new, because this information is so important. So thank you. I'm honored to have been with you, and I hope you have an amazing rest of the day. Hello?
All right. Is everybody on? Little technical difficulties, but I think we're back. All right. Matt, can you hear me?
Yes.
Awesome. And I think, Bob, if you just want to refresh, oh, I see you're joining back on too. If you want to just refresh your screen, that should help with your microphone.
Got it.
If anyone didn't hear my introduction, I want to welcome Matt Chetester, Director of Sales for ChemDoc, to this question and answer session. He leads their technical sales team in regards to ETO, hydrogen peroxide, parasitic acid, gas detection, and monitoring. We did get a ton of great questions that came through. So I am going to get as many of these asked as we possibly can. We've got only a couple minutes. I think this first question is actually going to tee up the remainder of this session nicely. It says, and honestly, it speaks to why this conference is in existence, why a safety conference exists dedicated to your safety in sterile processing. And the question is, why isn't there more focus on worker safety, especially when it comes to chemical monitoring? So Matt, if you want to take a first go at that question, that would be great. Why isn't there more focus on worker safety?
Yeah, it's a great question, and I think that's because hospitals are focused, number one, on patient safety, which makes a lot of sense, right? That's their job, is to get people in and get people out and make them feel better and do it in a safe manner. You don't want somebody to come into a hospital with one issue and maybe they leave with that issue solved, but then they have some sort of other issue that they've gotten while they're there, or they slip and they fall. So I think that's an honest answer. I think the sad part of it a little bit is that hospitals obviously make money by bringing patients in and out. And again, that's where they want to keep those people safe to continue making money. Sometimes, unfortunately, workers are a little bit forgotten about. And that's why it's kudos to companies like Beyond Clean. I'd like to say ChemDAC too, and there's many other companies out there too that have some experience. Bob's worked in the SPDs for years, and so have other members at the Beyond Clean team. Our owner has been involved in sterile processing and hospitals for years as well, and they see the need, and that's what we're here for. Is we're here to educate. We're here to remind those hospital employees to keep the patients safe. The first step is to keep your workers safe. Because if you can't keep your workers safe, you can't have the tools that the surgeons and the doctors need cleaned the right way and put back into the operating rooms and other rooms to be used the right way. So in my mind, let's keep the workers safe first. Let's keep those products being reprocessed the way they should be. And therefore, that'll help with your patient safety as well. So I just think it's really about getting the message out. And again, this is why Beyond Clean's doing this. So thank you guys.
Absolutely. Something that I think is a very interesting question that also came through is there data showing that facilities are overexposing technicians to hydrogen peroxide?
Yeah, so there's several different places you can go. There's this thing called the MAUDE database, and that's kept by, it's a federal database that you can report issues into. And this is, anybody can look it up. You just Google MAUDE database and you get it. It's accessdata.fda.gov. It's the manufacturer and user facility device experience. If you have an issue at your facility where something leaks or something breaks, you may have to call a technician from one of your companies. That should be logged onto this database if you contact them and let them know. And if you go through that database and you search the name of certain gases or certain equipment you have in your facility, you will find a list of issues that have happened. We've crunched some of those numbers, and I think you'd be quite surprised at how many are on there. And again, I think that how many that are on there are a small minority of how many there really are out there, because there's things that happen all the time that are not reported. We were at a hospital a few months ago. I won't name who, but somebody who works there told us about somebody, a worker who had to be passed out working around parasitic acid because they were overexposed and had to be dragged out of the room to safety. So again, then unfortunately, I didn't have any monitors. But so yes, there's MAUDE database. It'll show you when there's malfunctions. It'll show you that sometimes it's just human error. Sometimes you don't dry something properly before you put it in the sterilizer. And when you pull it out, to Bob's point earlier, as ChemDAC as a company, we're about safety. You should be wearing gloves. You should have a mask on because you don't want to burn your skin. You don't want to burn your nose or any of the tissues in there. But you also don't want to be breathing it in. So you can go to the MAUDE database. If you do some research or contact somebody like Beyond Clean or ChemDAC, you will find out that some of these sterilization companies have actually released studies. And what one company says is, yes, ours emit what we call fugitive emissions after the load is finished, but the other companies is worse. Well, the other company says, well, we agree that ours emit a little bit too, but their company is worse. So sitting in the middle, yeah, I don't necessarily know which 100% whose is worse, but they both agree that theirs emit some for sure. So, I mean, they built these products to work and not have issues. but everything has issues. Cars break down, houses catch on fire, things happen. So yes, there's resources like that. There's also been independent studies. There's an Italian study. ChemDAC ourselves, we have a lot of numbers that we could show you. If somebody reached out to us, we could give you some of the hospital information we've come across. We can't always disclose whose it is, but we can explain what it means. And typically it's because of a malfunction or what we call fugitive emissions. When the load is over, these machines are built to break down all H2O2 in the chamber. Unfortunately, they don't always do that. And so what you'll see is when you open that sterilizer door, the hydrogen peroxide is coming out and it's coming right towards your breathing zone. So again, if you have a monitor, you know that you can open the door a little bit, you can step back, you can watch the monitor, read that H2O2, and when that monitor drops back down to 0, it's safe for you to walk back up to the sterilizer and pull that stuff out. So yes, if you're looking for information, I would say MAUDE database, MAUDE, or contact ChemDAC, contact Beyond Clean, and we'll point you in the right direction.
Okay, thank you so much. There were so many great questions that came through, and Matthew, I will send those over to you so you can address those via email as we are over time for today's session. Thank you everyone for your engagement in all of these sessions. You've been such a great audience taking Saturday to do some really important learning on the safety that is involved with and required for working in sterile processing settings. So kudos to all of you. Thank you for being here. And we will see you in about 10 minutes in the next session. See you soon.
Thanks, everyone.
Thank you.